are Rosa and Abigail from Social Services. Thank you so much for being so patient. I know it was a long evening, but we're really looking forward to hearing from you.
It's totally fine. We understand, and we definitely enjoy educating ourselves also on other benefits that are out there for our community, especially because we don't work on that field. So it's always nice to know. I mean, we do encounter a lot of clients who sometimes have those specific needs, and
it's really helpful for you to know what everybody else is doing, isn't it?
Definitely, yes. So we really appreciate all the educational material that we received today from the other organizations. I'm going to go ahead and introduce Rosa Maria Alhambra. She's one of our supervisors in social services. I'm an eligibility technician. My name is Abigail, and I work with assisting programs. Rosa Maria will be introducing CalWorks, which is another of our programs. Today we'll be focusing on the assisting programs, which includes Medi-Cal, CalFresh, General Relief, and CalWorks. We will ask everybody to hold their questions towards the end. You can continue to put them in the chat. We'll do our best to provide you guys with the best information that we have available. If there is any questions that you guys ask and we do not have the answers, we'll go ahead and take those questions back, and then we'll be emailing them to Judy so that she can share the answers with everybody in today's presentation. So with that being said, I'm going to go ahead and start sharing my slide. I do want to apologize ahead of time. I know that we're a little bit short on time, so I might be speaking a little bit too fast just so that I can go through all of our slides. But again, if you have any questions, please feel free to ask in the chat. And at the end of our presentation, you can raise your hand. There's an emoji that you can use to raise your hand, and you can ask directly if you don't want to put it in the chat. Let me share my screen right here. Takes a second, I believe, to appear. Can you guys see my presentation? Perfect. Oh, let me find my mouse. Oh, here it is. Sorry. Okay, so today we are with Social Services Agency, and again, we work in the department that handles the assisting programs. With our vision and mission, we always strive to provide the best customer service possible, at the same time encouraging and trying to help our clients to be to find and that stability and be in that self-reliance. We do pride ourselves in always trying to make sure that everybody receives the best customer service possible. As you can see on the slide, this is the number of people that we normally are able to assist: 2 out of 5 children, 1 out of 4 adults, and 1 out of 6 seniors. This is the division of the programs that Social Services works with. Again, we will be concentrating on assistant programs, but we do have family programs as well. We also have a department that works with IHSS, and those have different application formats. Most of them are very familiar. So whatever information we share with you today, just know that if you were to want to apply for any of the other programs that we might offer, the eligibility process is very similar. It might differ if there's minors in the home, if there's seniors, if there's disabled people with disabilities, but usually it's pretty much the same. I'm going to be talking to you guys about the Medi-Cal and health programs. As many of you know, or some of you guys might have already heard, anybody who is 50 and over with an undocumented status that has the possibility of qualifying for full scope benefits. And what that means is that they can start going to the doctor, getting their medications. So if you guys have or know anybody that is 50 years and older that maybe was only receiving emergency Medi-Cal, which means that they could only go to the hospital and receive emergency services, but that were not able to continue their treatment because they didn't have money, or because their diagnosis require a higher level of care. Now they have the possibility of being eligible for full scope. we would still consider the household composition, meaning how many people's in the family. We do take into consideration income that includes Social Security. We also, as you can see right there, this is the people who are or can be eligible for our benefits. What we do is encourage everybody to apply. We've come across a lot of people in the community who say, well, you know, I have an income, and they don't apply. When it comes to medical insurance, the state is the one that sets the standards on how everybody is. So for example, what that means is if you don't have any income and you don't want free Medi-Cal because you would rather pay for your medical insurance, you will not be able to do so. Or if you are, or if you do, you might get penalized for it because it's the way that California has set the rules when it comes to medical insurance. If you have income, then you would qualify under a different kind of code. If you are above the low income level, then that's when you get referred to Cover California for you guys to be able to purchase your own medical insurances. These are the eligibility factors. You must be a California resident. If you move out of California, the clients are responsible for notifying social services agency that they are no longer within the state so that we can discontinue their case. We do take property into account, and this one applies mostly for seniors, for people who are already eligible for Medicare. So the first step will be you have to apply for Medicare. Once you get your denial or approval letter, you notify us, then we send you our packet, which tends to be a little bit lengthy, and depending on how many yes answers you provide, you have to provide the verifications for those specific yes questions. We ask for the tax filing status. If you are legally married, we do require both spouses' information. If you are not married, but you guys have a child, we require both parents' information. You don't have to request services, but you will be in the application, and you will have to provide verifications from you, even if you're only asking for benefits for your child. We do consider the income again, whether it's earned income, self-employment, if family is giving you money to help you out, we do also take that into consideration. Medi-Cal, Medi-Cal is just a version of Medicaid. Medi-Cal is a California program like most of the other programs presented today. It's for no cost or low cost health coverage for California residents. Excuse me. We do have annual renewals. And what that means is that annually you will be receiving a packet that you have to fill out, and you have to provide the income verifications of the time. For people receiving Social Security, they receive a letter from the state every year, or I'm not sure if it's from the state, but I know you guys receive a letter that tells you what your new income for the year is gonna be. We do request a copy of that letter every year you guys receive it, whether it's towards the end of the year or at the beginning of every new fiscal year. What does Medi-Cal cover? Medi-Cal cover outpatient services. Like I said, we have the restricted Medi-Cal. The restricted Medi-Cal only covers emergency services. With full scope Medi-Cal, you have access to way more than that: vision, dental, maternity coverage. If you have another insurance, you can still apply for Medi-Cal, and whatever your insurance doesn't cover, Medi-Cal will take over. Same thing with Medicare. If somebody is under Medicare, they can apply for Medi-Cal, and Medi-Cal will pick up whatever the other insurance does not cover. The only thing that I know we don't cover is co-pays that you have to pay. Laboratory services, like I said, dental services, vision. I know it covers substance programs as well. So if you know somebody who's struggling with a substance issue and would like to go to rehabilitation, Medi-Cal will, there's a lot of programs that work with Medi-Cal that will actually be covered under Medi-Cal. and we call it Drug Medi-Cal. So if you Google it, also you can find the phone number that you have to call. The person has to complete a phone assessment. It's over 30 minutes. So I always tell the people, if you really want to do it, just make sure you make the call when you have time, because it is an assessment. They can do inpatient, they can do outpatient. Most of the time they start with outpatient if there's no beds available, if the person is requesting inpatient services. For the dental services, I know it covers dentures as well, whether it's partial or full dentures. Vision services covers the eye exam. I believe it also covers glasses. If you want something more upgraded, you would have to pay for the difference if Medi-Cal doesn't cover, and usually the places, the optometrists, they will tell you, this is what Medi-Cal covers, this is the frames that Medi-Cal covers, and this is the type of glasses that you can get that Medi-Cal covers. Individuals determined eligible to receive Medi-Cal benefits will be issued what we call the big card. I don't know if you guys have seen those. They used to be blue and white. The new ones have more like flowers in there, but you can still use both. It's just the new version of it. If you lose it, we always tell people, call, request the new one. Usually all providers should be able to look you up by your social security number or the full name and date of birth. Immigration status. The only thing that has changed right here is for people 50 years and over. Anybody over 50 and over can qualify for full scope Medi-Cal regardless of their immigration status. Anybody below that, unfortunately, they will continue to qualify only for restricted, except children. Children do qualify for full scope. After 18, I believe, is when everything takes the change. They have to provide proof of citizenship status, whether is they are DACA, whether is they have their residence, they have work permit, they they're naturalized citizens. We do require the verifications on that. Who's considered age, blind, and disabled? An age person, someone that is over 65 and older. Blind, a person that has been declared legally blind by the Social Security Administration or the Disability Determination Services Division, which are the state programs. Disabled person would be someone who has been declared disabled by the Social Security Administration or the Disability Determination Service Division. A special Medi-Cal programs for age, blind, or disabled person. Again, we do recommend for anybody that is not sure or that would like to apply for Medi-Cal to apply. We would determine if they qualify. If they don't qualify, it's really hard for someone to come to me and say, hey, Abby, do you think I qualify for benefits? Because we have so many buckets out there of coverage. We always tell people, just apply, let us review your case, provide all the verifications, because if you don't qualify for the full scope, you might qualify for this other one, or you might qualify for other one, especially for the age and disabled programs. We have so many of them that I believe that people choosing not to apply because they don't think they're gonna qualify, and they are missing out on the possibility of actually qualifying for at least one of our programs. We have the 250 working disabled program. For this one, the person must be able to work, and it's another program that we have. The age and disabled federal poverty level is the one that has a share of cost. The other ones do have a share of cost. Again, we have so many that it's really hard to say, oh, you will qualify for this one, or you will qualify for that. Normally what we do is we receive all the verifications, we put all the information into the system. Once everything is confirmed, we run the system, and the system tells us this is the program that the person qualified for. Medicare Savings Program is another of our programs. OMSPs are subject to property limits. pays for Medicare Part A and or Part B. That means that they have their premiums, the deductibles, and their co-insurance fees. This is the part of in-home support services. In-home support services assistance with domestic, personal care, and other services to adults who are low-income, disabled, or blind. Medi-Cal intake is co-located with in-home support services to take and process Medi-Cal applications. That is the phone number that you want to call if you guys want to apply for in-home support services, or if you know someone that could potentially qualify. A lot of times we have situations where the family, the mom or the child's taking care of a relative, and you know, our culture normally we do it because it's our family member, we care for the person, and we want to try to help. What many people in those cases ignore is that if that prevents you from working, you can technically apply and be receiving some sort of income while you're helping your relative or the person you're caring for. So we do encourage people to also try and take advantage of those benefits, because it's something that is beneficial for you and is beneficial for the person. Now, if you have a family member that requires a high intensive care, you can still apply for the person. If you don't want to be doing home support because you work or because you have other things to attend to, what they will do is they will send you a list of people who work with them that you would have to call and kind of like conduct interviews and then decide which one will be the best fit to care for you, for your family member, or the person that you are helping out. Immigration and Medi-Cal questions. The California Department of Social Services funds qualified nonprofit organizations to give services to immigrants who live in California. This is the list of organizations, and you can see the links right there. We can send you the links also through an email once we compilate all the information so that we can give it to Judith if you guys would like that information. Home and community-based services waivers. Waivers programs provide expanded Medi-Cal services to certain individuals to allow them to live at home rather than in an institution. Individuals may apply through various community partners. This is the ones that we have. I know that we also have a division within our department. I wouldn't be able to give you information about the other ones because unfortunately I don't work with those programs and I don't know what their criteria is or what their process looks like. But I know that this is the ones that we have: HCBS waiver, formerly known as IHO. And basically you would just have to contact them and let them know that you are trying to apply for a waiver. The multi-purpose senior service programs waiver, that one is managed through CalOptima, so you can contact CalOptima if you're interested in applying for that one. The assisted living waiver, individuals are referred to the care coordinator agency and they conduct a care assessment level. Share of costs. If the applicant's net countable income is above the limit for any non-match Medi-Cal program, that means that they don't qualify for full scope Medi-Cal, the applicant will have a monthly share of costs. The share of costs must be met for the month before Medi-Cal covers any services for that month. The Disability Determination Services Division, when a customer requests to be evaluated as being disabled, counties can submit the DDSD packet. Presumptive disability, the completion of this form expedites the individual's eligibility evaluation if the disability criteria noted in the form is met. Authorized representatives, like in every other agency, you guys can have an authorized representative when you have any of our programs. If you have an authorized representative for this year and you want to keep that person, you have to make sure that you add them onto the new onto the renewal packet. If you guys don't put the information, we will discontinue the authorized representative. You can always change that if, let's say, in the middle of the year or within a month, you decide, well, I don't want them to be my representative anymore. Now I want this other person to do it. You just have to contact us, fill the new form, give us the information, and we will update our system. But again, if you have any of our programs and your annual recertification comes up and you don't add them into the new application, we will not pass it along. We would terminate it because it's only for 1 year. This is the cards that I was talking to you guys. Some of you guys might have seen them. Some of you guys might have them. If you have one or the other, it's totally fine. You can still use them. No provider will reject it because you don't have the brand new one. The other one, yeah, it's cute, it's colorful, but if you want that one, even if you already have the white and blue one, you are more than welcome to contact us and we can go ahead and send you a new replacement. We work very closely with Cal Optima. What happens with people who have a certain type of income, they are referred to Cal Optima. So when it comes to assigning your providers, you will contact Cal Optima for that. And one of the nice things that I just found out and that I learned is that your Medi-Cal does cover emergency transportation to the hospital. What it doesn't cover is the services that you receive during that emergency call. So for example, the paramedics arrive and they take your vital signs because it's their job. You don't have to take those services. You can just tell them that you want them to transport you to the hospital. And that's the only thing that is covered by Medi-Cal. If you receive any services from your location to the hospital, that's basically what they're billing you for. CalFresh. CalFresh is one of the programs that we have, and this one is for people under a certain limit, income limit. And with this one, you can buy food. Now, we do have it where seniors, disabled people, or even indigents can actually get hot meals. They can go to restaurants and actually use their CalFresh for that. It doesn't apply to the general population. You have to meet certain criteria in order to use it at restaurants. This is the considerations that we have for this one, which is the household size. When we ask you for your household size or your household composition, we're asking for the people that you purchase and prepare food with. Whoever you mention that I purchase and prepare with this person, that we are gonna be requesting that person's information as well. If it's an adult, we will be requesting their source of income as well. If you are legally married, we will be requesting the information from both. It doesn't matter if your husband or your wife or your spouse is not requesting. If you are requesting and you're married and you guys purchase and prepare food together, we will be requesting that information. Children under 22, anybody who's under 22 and still lives with the parents, you have to have the parents in the application. Anyone over 22 can apply on their own. But if you purchase and still prepare food with your parents, we will request their information and their source of income as well. Expenses, we do give credit for certain expenses such as rent, if you pay bills, whether it's just the phone bill. Let's see what else. If you have vehicles, we request the vehicle information. If you go to school, we request proof of that you are in school, if you're a full-time student, part-time student. If you receive financial assistance, we request proof of that. But we do have that criteria that gives you credit for it. It doesn't give you the full credit. There's a max that we have. So for example, you pay $2,000 a month for rent, we will not be crediting you for the $2,000. The max that we have right now, I believe, still $597. So if you pay more than that, we will only be crediting for that, which is a nice help because it's kind of like we are acknowledging, you know what, you have bills, you have other stuff that you need to take care of. So we do take that into consideration. What can you purchase with EBT? You can basically purchase food. That's all, just food, no alcohol. Nothing that is not eatable, you cannot purchase with EBT, but anything that you can prepare to eat, that would be covered. So here's what you can purchase. Again, the first one, the hot food, it doesn't apply across the board. We have our seniors, we have our people with disability, we have our indigents. They are the ones that most likely will qualify to be able to get hot food. So no alcoholic, no tobacco products, no vitamins, no medicine, no pet food, non-food items, as I mentioned before. This is the links where you can look up where you can use your EBT card. The easiest way basically is you walk into a store, a liquor store, and you will see the sign that says we accept EBT. If you don't see it before you make a purchase, ask the cashier if they take EBT. Sometimes they do and they just don't have the sticker. But I have come across circumstances where they don't. And I've heard from people where they're like, oh, I went to the store and my card didn't pass or they didn't take it. And we always tell them, please make sure, even for the hot food meals, we always tell them, before you make the purchase, check and ask the staff if they take EBT, so that you're not wasting your time and you don't, you can just find a store that does and make it more convenient for you. Restaurant meal programs is what we talk about when we say hot food. So this is for elderly, disabled, and homeless people. More than 300 Orange County restaurants participate. This is the website where you can look it up. If you are at any of our regions, we also can provide you with the listing. We can't tell you that it's 100% updated because we're not, I don't think we're the ones that manage that. I'm not sure who's in charge of making sure that that list is up to date. Or if you call us and say, I would like the listing of the restaurants that are participating in the restaurant meal program, we can also mail it to you guys. What does a household consist of? You already went over a little bit, but this is basically what I was sharing with you guys: an individual living alone or with other who buys and prepares food separately. So if you live with your parents, but you don't purchase and prepare food with them, your household size is 1. If you purchase and prepare with your parents, then your household size would be either 3 if you live with both parents, or 2 if you live with one. A group of individuals, related or unrelated, residing together who purchase and prepare food together. Again, the keyword is, do you purchase and prepare with this people or with this person? If you say yes, they're part of the household and we will be asking for their information. There's been circumstances where I would have a parent trying to apply for food stamps and they live with their kids, older kids who already work, and they don't want to provide them with their income verifications. That is a huge problem when it comes to the eligibility part, because if they don't provide, we have to deny the application. And it's, I've had very unfortunate situations where I can tell that the people really need the assistance. But, it's when it comes to family, it's really hard. I had this lady, a senior, calling me and the daughter was frustrated with the mom was frustrated with the daughter, and it was really hard to get him to agree and understand that if you don't provide me this documentation, I have to deny your case. Luckily, towards the end of the conversation, I was able to get them both to agree, but it was a very long conversation going back and forth and trying to help them understand, like, it's not optional. You have to give me that information or I have to deny your case. If an individual is under 22 years of age and lives with parents, this is considered one household and they must apply all together. I've had situations where the mom already has a case open. Well, in that case, you don't need a new application. What you do is the mom has to call me and tell me, I want to add my daughter, or I want to add my son, or I want to add my other child, or my nephew, or whoever it is that just moved into the household and now they're purchasing and preparing together. Who may be eligible? CalFresh must be a resident of Orange County. If you live out of the county, you cannot request benefits from Orange County. Each county has their own bucket for this type of services. So if you live in Orange County and move out of county, you need to let us know so that we can transfer your case to the current county. The process can take up to 30 days. And most of the time, we can catch that pretty easily. Basically, we just go into our system. We can check, we can actually track all your transactions and see where you've been doing your purchases. And that's how we ended up transferring a lot of the cases. I had clients that say, oh, but I don't live there. But if you spend over 50% of your time in that county, then that's where, unless you can prove to me that you're living in California, in Orange County, I will be transferring your case out. They must be a citizen or eligible non-citizen, meaning a resident. They must be, they can be eligible elderly or disabled individuals who receive Social Security payments. Medi-Cal does work a little bit different than CalFresh. For CalFresh, you do have to have some sort of legal residency in the United States in order to qualify for this type of benefits. But again, every case is different. I know we have people who are in DACA. I don't know that DACA is one that can qualify for these benefits. The best way to find out is just apply. We have parents who are residents and who do not want to apply for the benefits because they might be going through the process of citizenship and they don't want anything to be negative. As far as I know, CalFresh does not affect negatively in that area, but we always refer people to speak to a legal advisor, check with them, and then make your decision. I had people that say, but it's just my case. And I always tell them, please talk to a legal advisor and let them let you know, and then make your decision based on that. If you have someone in your house who is, any kids that are US citizens, you can apply for your kids. You don't have to receive the benefits. You still are gonna have to provide all your information, but you can still get benefits for your kid. This is right now the gross income for every household. So if you are below this number, you will qualify. If you are above this number, you will not qualify for the benefits. What I tell people, and maybe you guys have heard of it, and you know, it's funny because it happens a lot where somebody says, well, I apply and they were only qualify me for $10 a month. What am I gonna do with $10? The good thing about those $10 right now and during the COVID season that we're living is that the state of California is giving an extra incentive in CalFresh for the people who have an active open case. So what I tell people is like, look, just apply. Even if I only qualify you for $5, you're getting that extra money from the state. Once that is over, you can go ahead and close your case. You can do whatever you want. But I believe it's around $400 that the state is sending to every open case monthly. That to me is like, it's a huge help. I don't know if you guys have noticed it, but our food prices are skyrocketing. You know, I used to be able to spend $50 in the groceries for a whole week just for my kids and myself. Now that has like tripled. So to me, I tell people, look, just let me make sure you don't qualify. And when I tell them, oh, you only qualify for $20, I have people who get really mad at me. They're like, $20, what am I going to do with $20? I'm like, listen, the state is going to give you like $400 on top of those $20. It's your call. You can withdraw the application, nothing wrong with it. There's nothing to be ashamed in getting assistance when you know you need it. And we always try to encourage people, just apply. Just apply because you just never know. And if you qualify, again, that extra incentive that the state is giving out, we have no control over it. We cannot even check it, but we know it goes out monthly between the middle towards the end of the month. This is the maximum allotments that you can get. Right now, this is actually not updated, so I do apologize for that because it just went up to $281 for the household of one. So, I mean, it's not a lot, but $30, it's a lot of money, especially with our food prices. So this is the process. Basically, you apply for CalFresh, complete the interview, then we determine the application outcome, denial, approval. If it's approved, you get your EBT card. The fastest way to get it, we tell people, I can mail it to you, or you can go to any of my regions, pick it up, and you're all set. It's the fastest way for anybody to get an EBT card. The interview is not negotiable. Anyone who applies for CalFresh has to have their interview, and that takes about 30 to 45 minutes, depending on the circumstances. But it's a must. Annual renewals, they have to complete the annual renewal interview as well. And I'm going to finish with general relief. General relief is a loan program that we have for individuals who have no source of income at all. It's a cash assistance program funded by the County of Orange, provides temporary cash aid to eligible indigent adults. They have to be a U.S. citizen or have some sort of legal immigration status and be residing in Orange County. Again, if you move out of county, you have to apply at your county. This is one of the programs that we cannot transfer to the new county. If you move to another county, let's say someone moved to LA County, we have to discontinue here and you have to go and apply over there. This is the eligibility criteria. Income, liquid assets, meaning do you own anything? Do you own a vehicle? What kind of vehicle it is? Citizenship or legal status. Resident of Orange County. We look at the living arrangements, economic unit composition. This is the categories for the two different types that we have, which is the employable and unemployable people. Employable is considered someone who can physically and mentally is capable of working. They have to register for the CalFresh Employment and Training Program. It's non-negotiable. This program is way more strict than CalFresh and Medi-Cal itself because you actually have a case worker that is going to be working with you directly. Benefits are limited to 90 days in a 12-month period. Once you, and it's only eligible, again, like 1 year. So if you get your 3 months, you have to wait till the next year to apply again for that program. And then the payback, I believe the workers work with you guys to make sure that you work on a payment plan. Unemployable is people who are permanently or temporarily unable to work. Eligible if the incapacity is verified by a medical provider. There's a medical form that has to be filled out and you have to return it to the worker within 30 days in order to qualify for it, or your case will be discontinued. You can always reapply, but I know that, for example, if you're not cooperating with the program and you just keep on applying and applying and applying, it comes to the point where they tap you out. Benefits are not limited for that one. So with the unemployable one, we have people who are applying for Social Security or they're waiting for the decision on the Social Security. And what happens then is that if it gets approved from whatever your, sorry, I lost the word, your back pay. So for those that don't know, people who apply for Social Security, if your case gets approved, they do a payback, meaning that they pay you from the day you applied. So that money that you got from general relief will get deducted from the back pay. And with this, I'm gonna go ahead and hand it over to Rosa Maria. She's gonna be talking to you guys about the CalWorks program. And then I'll just be navigating the PowerPoint for her. And we'll go ahead and take your questions after her presentation.
Hi again, this is Rosa Maria. I will be talking in a little more detail about the CalWorks program. So CalWorks is the California Work Opportunity and Responsibility to Kids. So basically it's just a California program. So what is CalWorks? It is a cash aid program for low-income families. It is also referred to as the Temporary Assistance for Needy Families, or TANF. So in other states, they call it TANF. Like CalFresh, the benefits are also on the EBT card. The goal of CalWorks is to help you be self-sufficient. So with that being said, adults are eligible to receive cash aid for 60 months, and children may receive cash aid until they turn 18. So you may ask, can CalWorks be combined with CalFresh? And the answer is yes. Most families often receive both CalWorks and CalFresh, including cash-linked medical. Next slide, please. So who may be eligible? To be eligible for CalWorks, you must be a resident of California, a U.S. citizen, or legal permanent resident. You can be eligible if you are the parent or caretaker relative of a child under the age of 18 and living in the home. Your benefits will continue until one of the following occurs. the teen turns 19, the teen graduates from high school or completes a vocational or technical training program, the teen stops attending school full-time. It is important to note that there are additional eligibility for teens underage until they turn 19. If a teen meets a disability criteria in CalWORK's eligibility. Next slide, please. So welfare to work. All adult CalWORKs recipients and children 16 to 18 who are not in school are required to participate in welfare to work. So unless otherwise exempt. Like I mentioned earlier, the goal of CalWORKs is to help you be self-sufficient. So the means to be able to achieve that goal is the welfare to work program. You as a participant will be provided with supportive services to remove barriers to employment, which may include childcare, transportation, and ancillary funding. Childcare can be provided when you participate in an approved welfare to work activity and to obtain or retain employment. For transportation, it could be either mileage or bus pass. Ancillary funding is available for participants who need certain expenses to help them participate and be successful in their welfare to work assignment. Examples are clothing, which are needed for work, books for school or training, school fees, which does not include tuition, tools, and diaper payments. Next slide, please. So the barrier removal services should minimize the duration of instability experienced by a family during a specific crisis or situation by providing intensive care management, family stabilization, which we call FS, domestic abuse services, behavioral health services, which is BHS, public health nurse support, which is PHN, employment support services, which is the welfare to work, supportive services, which covers childcare and transportation, referrals to community-based organizations, housing support, and the home visiting program, which is HVP. The mental health and substance abuse services provided to CalWORK's welfare to work participants are in order to remove barriers to employment and facilitate successful participation in a welfare to work activity. The homeless and housing support addresses the needs of our homeless families through homeless assistance, which covers temporary and permanent housing support program, family stabilization, and the employment support services. Next slide, please. So CalLearn. CalLearn is a program which is part of the CalWORKs program, like as a whole. This serves pregnant and custodial teen parents under the age of 19 who have not obtained a high school diploma or equivalent. The CalLearn program provides fiscal incentives as well as needed supportive services and intensive case management to encourage pregnant or parenting teens to stay in the program or return to school and graduate. The purpose of the CalLearn program is to reduce the chances of long-term welfare dependency by serving pregnant and custodial parenting teen parents under the age of 19 who have not obtained a high school diploma or equivalent and are receiving CalWORKs. So there is an assigned specialized case manager to these cases. And this specialized case manager monitors the progress in school, determines exemptions, and good cause. They also complete monthly contact reports because they have to reach out to the clients every month. They determine bonuses or sanctions based on CalLearn educational plan. They request supportive services. They link each parent to needed health and social services available in the teen parents community. They also provide intensive case management services in accordance with Adolescent Family Life Program standard. Next slide, please. So how to apply for the CalWorks or even the CalFresh and Medi-Cal? So as social services agency staff, we are ready to connect residents to services. This slide shows you all the ways to reach us. So you could apply online on My Benefits CalWin, which is we call it My BCW. You can apply for CalFresh at getcalfresh.org. You can apply for Medi-Cal at coveredca.com. The SSA Submit is an online portal which allows clients to upload documents and verifications. We will be talking about Covered California and SSA call centers in the coming slides. You can also fax your Medi-Cal and or CalFresh applications to respective phone numbers on the screen. So it shows the 800 number that right there. And then you can also go in person. During the pandemic, our offices were closed, but now we're starting to open. And you can go into, the list, which is on the coming slide, the SSA locations that will be shared in right here. So I'll pass it back to Abigail.
Thank you so much, Rosa Maria. We're coming to the end of our presentation. We do apologize for taking some of your extra time. As she said, this is the call centers that you can call and apply. You can apply over the phone. You can apply online through mybenefitscowen.org. You can always walk into any of our locations. It's really hard for us to tell you what specific times any of our locations are more busy than others. But you can definitely call it in and you can do the application process over the phone. The representative that you speak to will let you know what verifications are needed in order to complete whatever it is that you're applying for. Again, this is just the web.
Oh, I think Abigail froze. Well, okay. Abigail and Rosa, go ahead, Rosa.
Yeah, so I'll just discuss this just like a couple more slides. So it's the same as what I said earlier. You can go to My Benefits CalWin, which is an online application process, or you can, the easiest way, if you are willing to go to one of our locations, you can definitely come in, and if you want to call ahead of time, you can do so. The numbers are there as well.
I see some of the questions. The one that says, will social services help a person get SSDA benefits? We don't work with Social Security. So anything that has to do with Social Security, you would have to contact them directly. If an autistic person needs help from social services, they can definitely apply for any of our benefits, Medi-Cal, CalFresh, general relief if they're homeless, or I don't believe they can apply for CalWorks unless they have a minor child, as Rosa Maria was saying. But unfortunately, we do not work with Social Security, so we are not able to help in that end. Oh, Judith had already answered that. Thank you so much, Judith.
Okay, at least you proved I was right. Nice to be right every once in a while.
Can one department assist for getting services from another department? Only if the person is trained as a dual. For example, I'm a dual worker, so I work with Medi-Cal and CalFresh. I can help you with those two programs. If you're asking about general relief, CalWorks, or anything like that, I can try and get answers for you. I cannot help you with the application process. I will have to refer you to the appropriate department for that.
Abigail, let me ask you a quick question. Part of the reason I wanted you to speak is during COVID, a lot of, every once in a while I would get a call or some communication from someone who just hadn't worked in a long time. They were just basically hanging in there, and they were really worried about becoming homeless. So I thought of you, the program that you described in terms of kind of, you talked about it loaning you money, but how much money are we talking about that someone might be able to qualify for?
It's not. Okay, so general relief, you cannot have income. If you have a job and you get paid.
Yeah, no, these are people that have lost their jobs. So, and
they can apply, if they're homeless, they can apply. Or what I would suggest that they do, because I'm not a general relief worker, contact the 800 number, talk to a general relief specialist, let them let you know if they qualify, because they will be able to let them know. It's a case-by-case scenario, but I know that if they don't have any source of income, every application is different, and I don't want to give misinformation.
Okay, so it really is, and it depends.
Yes. I would want to add on to what Abigail said. The general relief program is should be understood as just an individual. If it is a family, they will let you go to CalWorks. So if you're by yourself, then you're homeless or you don't have a job, you can do general relief. But if you have yourself and a child, then CalWorks would be the best option, because even if you apply for CalWorks and you apply for CalFresh at the same time, then you could be approved for CalWorks, CalFresh, and Medi-Cal, which is cash-linked medical. So you don't have to do 2 applications. You can just do 1 application and have all 3 programs at the same time.
Okay.
And that's the beauty of CalWorks.
Yes. Yes.
So I wouldn't, and that's one thing with us, for example, Medi-Cal, general relief, and CalFresh workers. If we see that you have a CalWorks case, we will not touch your case. We will contact your worker and have your worker contact you back, because you do have an assigned worker with them. Now with us, that's in works to change, but on the time being, we don't touch any cases that are CalWorks.
Okay.
Somebody's asking, Carla is asking, if you aren't working because you're a full-time student, are you eligible for CalFresh? Carla, the best answer that I can give you is go ahead and apply, because even if you're not working, we know that you guys receive financial aid. I will tell you that I haven't seen any applications denied. Yet again, that all depends on if there's any other type of assistance that you're receiving from family. But the best thing you can do is apply. Just apply, let us review your case. Right now, it would be kind of hard because I don't want to take everybody else's time, but go ahead and contact our 800 number, talk to a worker and let them know your situation. And they might tell you, let me take your application, let's review it and let you know. Just make sure that when you call, you have about 30 to 45 minutes, because you will there will be an interview conducted. If you don't conduct that interview, it will be denied.
So
go ahead.
Yeah, I think we should probably be, it's getting pretty late for everybody.
Yes,
but
I know.
Abigail, thank you so much, and Rosa Maria, and thank you everybody for watching. One thing I wanted to mention, and are you guys familiar with 211? So 211 is a service, is an informational service that you can dial, and they have, if you're in a situation, they will refer you to the right agency or to the organization. So it's kind of, if you are in a crisis and you do need help, that's a source of help that can help direct you. Because one thing is, it's all very complicated, and there are other organizations that we didn't meet today. So that, you know, as I poke around, I discover certain benefits that I said, oh, that would have been good to know. So
in addition to your 211 information, Judith, 211 also is like a directory assistance, because it has all the other services, not just if you're in crisis. So even if you need like legal information, they have, it's like a directory of all services, like childcare, legal, like, you know, like you said, if you're in crisis or anything, they have that list. So yeah, so they're the best alternative to call if you need
Yeah,
information.
a one number to help direct you through this whole maze of other services. But, and I also wanted to mention one thing, my son Josh is on CalFresh, and it was through you that I think he heard about a discount of $30 on internet services. So once you qualify for certain kinds of benefits, sometimes you can have savings on utilities and other costs. So it's an advantage of taking advantage of some of these things. But with that, so I'm luckily, many of our speakers provided me with their presentation. So you will be getting that and a link to the recording in the next few days. But thank you all for coming, and thank you to our speakers who were fabulous, and just wish you a great week. Thank you.
Thank you for having us. Good night.
Good night, everybody.